Hey everybody. So today I wanted to talk kind of in depth about depression and how bad it can be. There are so many reasons that you can experience depression. You can have chronic mental illness, um, like me. I have schizoaffective disorder, which is bipolar and schizophrenia at the same time. I have other stuff too, but those are my main diagnoses. So, like with bipolar depression, you might get these highs, mania, hypomania, and it's usually followed by a crash. And the depression is really, really bad. And one of my first psychiatrists told me that bipolar depression is generally worse, but I don't want to downplay depression at all because it can be just as bad for anybody for any reason. You have postpartum depression, you can have depression from the seasons changing, seasonal affective disorder, you can just experience some kind of trauma, something bad in your life, and get depressed from that. With COVID 19 and the pandemic, there's been a lot of people who are getting depressed, but it's understandable because, we're shut down, locked in the house, things aren't back to normal. You can't just get out and socialize the way you used to, and you have to worry about masks and crowds and all that stuff. And cases are surging again and places are reimposing like mask mandates and restrictions, and just being isolated, it's really hard. And people have become ill with COVID, and then they get long COVID. Not everybody, but they are just sick for like a long time. That can be depressing. Any kind of, like, you can get diagnosed with cancer or, I mean, anything, and you know go through depression. um it it's just really hard to explain unless you've ever actually experienced it, but I'm going to try as hard as I can. And I am going to make another video about how you can help someone who is depressed. So, this is not medical advice. And of course, if you're having suicidal thoughts, if you're making plans, if you can't shake it, you need to see your doctor. If it's a primary care doctor, a psychiatrist, it's hard to get in. So, like, as soon as you can see someone, you need to go ahead and see someone. Therapy really does help. Not all people will agree with that. Um, some people just don't like therapy. And when you're talking about something with, a stranger, until you really get to know them and go a few times, it is really hard to talk about things. And it makes you think about it and it brings up memories. And, like, in my experience, sometimes after going to therapy, you just kind of feel like crap because you've talked about all this stuff and it's on your mind. And even a lot of doctors and psychiatrists, they sympathize with you and they try to help you, and they see other patients who, have similar experiences that you do. But unless they've ever experienced it, they still can't empathize with you. They still can't fully understand, what it feels like. So, based on my experience, I'm kind of chronically depressed to a certain degree. My medications are fairly stable right now. My depression is fairly stable, but I made a video about my suicide plan, which is just like the worst I've ever been depressed. When that happened, I just laid in the bed and stared off into space. It was like time went super slow and I was painfully aware of every second. I just wanted it to be bedtime so I could just go to sleep and escape reality. But then again, depression can affect your sleep. So, there would be nights that I was just like awake, being depressed. Or, I'd sleep a few minutes and wake up, sleep a few minutes and wake up. And depression is just, it's like torture. And truthfully, you're not really in your right mind, so to speak. You know, like, I have curled up before and just laid there and stared off into space for like ever. I've, you feel like you can't put into words how you feel, and you kind of can't, to people around you who do not know what you are going through and haven't experienced it, you feel completely hopeless. You know, there's just no hope. You don't want to go on. Then you can start having the suicidal thoughts, and then it can progress, and then you start making a plan. My suggestion is when you start experiencing depression, you need to get in with your doctor, like ASAP. In this country, it is hard to find a therapist and a psychiatrist who has an opening and who can get you in quickly. So if it's something you kind of deal with here and there, you should reach out and, try to find a therapist. They can also, give you resources in your area to help you. Also, if you need to go on medication, a primary care doctor can like get you started on something, and it just depends on your doctor. But really, based on my experience, if it's something you deal with, you need to see a psychiatrist. That's their specialty. They've went to medical school, they've done all the extra training in psychiatry. But it's important to try to find someone who will work with you and like compromise, so that it's not just them, you know, telling you exactly what to do and exactly what meds to take. Like, they are the experts, but we do know our own bodies and what we want. And if we've tried meds before, we know what doesn't work for us. We're all different. And if you go the medication route, just know that it's very likely you'll have to change your meds until you find the right combination. But when you start feeling better, don't stop taking your meds, because you can go through withdrawals, and those suck really bad. And that alone can make you depressed again. But it is really hard to find people who understand, and it is really hard to get your foot in the door with a therapist, with a psychiatrist. So it's something that if you deal with it, don't just try to ride it out and let it get better. You need to like be proactive and try to have those resources already in place, because when you're in the middle of a crisis, you're just not motivated to find anyone. If you do try to find someone, a lot of times it's going to be a while before you can get in for an appointment. And a lot of psychiatrists and therapists, in my experience, are just so booked up, they're not accepting new patients. So it can get so bad that you end up at the ER. And there's inpatient programs, there's outpatient programs, there's group therapy, there's individual therapy. Personally, I prefer individual therapy. I've just found it to be much more personable, and they get to know you and your story, so you don't have to tell it all the time. But a lot of people do like group therapy too, because you're with other people experiencing the same thing that you experience. So they understand. There's groups on Facebook you can join, and it's not people in real life, but it is people, and you can talk to these people and they understand what you're going through because they've been there. They might have advice, they might have tips. It's not really easy to explain how to come out of a depression or how to feel better. When you're really depressed, you don't even want to take care of yourself. You can't clean the house and, be the person you normally are and, take care of things. You can't take a shower. You can't put on makeup. You don't care what you look like. You may overeat, you may not eat at all, but it's really important to try to make sure you eat. Try to get as much self care as you can, even if it's just, splashing water on your face and brushing your teeth. Like, it's really, really hard to care about yourself when you're really depressed. And sometimes you just don't care about anything at all. You have to look for reasons, to like really think about reasons that you need to hold on and that you need to fight and get better. For me, it was um, mainly, for me, it was my religion first, and the way I was raised. We were taught if you commit suicide, it's like a straight ticket to hell. And I definitely didn't want to risk that. Um, Secondly, I was afraid I wouldn't succeed if I tried to attempt suicide. And then I would just end up as like a vegetable stuck in a bed, and that would be an even worse fate. And then I obviously care about um, hurting my loved ones. I didn't want to put, like, I didn't want my husband to find me and have to deal with that. I didn't want to hurt my family that way. And most people hate me saying this, but it is true. It will get better. You kind of, in a way, have to suffer. You just kind of have to suffer through it. It's an illness just like a bacterial or viral illness. And, the doctor, if they're like, oh, it's a virus, you just got to wait it out, or like the flu or whatever, it sucks really bad and you're miserable. But it's hard because it's your mind, and it like plays evil tricks on you and tells you you're not good enough, you're worthless, it's hopeless, it's never going to get better. Even if you get better, it'll come back, and it might. But that's why you need to have like some kind of support system set up so that you can deal with worsening depression or like whatever's going on with you. You really can't expect results overnight, even with medications. They take a couple weeks before they like really start working. But in my experience, even after 2 or 3 days, for me, they've seemed to at least help a little bit. If you are able to get up and do anything, do something that you enjoy, like, you know, light candles and take a really nice bath with like scented bath products, instead of a shower if you don't feel like you can take a shower. If you're taking a shower, throw one of those little like scent bombs down and just, breathe in the vapor while you're taking your shower. And, don't worry about doing your hair or your makeup or dressing cute. It's about taking care of yourself and whatever mentally helps you. I enjoy watching like the adult cartoons like American Dad, Family Guy, South Park, Bob's Burgers, some old ones like the Andy Griffith Show or MASH. Just things that you enjoy. Try to incorporate as many of those things into your routine as you can. Try to take your mind off of it. It's really, really hard. It's always there in the back of your mind. But you can have better moments even in the middle of a really bad depressive episode. And it's you just really can't explain it to someone who's never experienced it. And even those who have, it's really hard to put into words. It's just something, it's like a shared experience with someone who knows what it feels like. You know, it's hard to say, go get your nails done or something, go shopping or something like that, because you may not even feel like getting up out of the bed, and it drains your energy. So you just like have no energy to do anything. But like I said, at the like least, try to wash your face and brush your teeth. Make sure you eat, make sure you stay hydrated. Any kind of physical symptoms like dehydration or being hungry, it just makes you feel worse. So anything that you can just force yourself to do to try to make yourself feel a little better, even if it's for 5 minutes, you need to do that. Like I said, like I'm in some Facebook groups, and it's nice to be able to post and be like, this is how I'm feeling today. And people do empathize with you because they have went through it, and they can, say things to you to make you feel better, or just let you know you're not alone, because you're not. Tons of people deal with different types of depression, but there's so much stigma around mental health that people feel like they have to bottle it up and can't talk about it. And when they do try to talk about it, people may not understand, or, my family still to this day sometimes will say, oh, you just have to fight it with your mind, and that's just, you can't do that. And it's hard to try to explain, like, it doesn't work that way. But it really does start to get better at some point. You can be depressed for years. I've been depressed for years. I'm always slightly depressed. But for me, with seeing my psychiatrist, having therapy, and they can teach you like coping mechanisms and little breathing exercises and grounding exercises and stuff like that that you can do to like try to help you feel better when you're having anxiety or depression, and also anxiety often goes along with that. And it's scary because something's happening to your body and it's your mind, and you sometimes just can't get out of that funk, it seems like. But it really, really does get better. It really does. Like, you suffer, it's terrible. But, you know, when it's over and you look back, you know, there is a sense of pride that you made it, and, you are getting better. And you shouldn't try to, like, just get through it on your own. You need to get some kind of help, even if it's just therapy or going to your doctor and just talking to them. Because, like I said, it is hard to get in. So it's nice to have those resources in place so that you can get in and talk with someone when you need to. I know there's like a lot of online stuff now since the pandemic where you can like talk to a therapist or whatever. I've not tried those, so I don't know how well those work. But I would suggest, if you do them, and if it is possible, I don't really know anything about it, try to stay with the same therapist and give them a chance, um, because you do have to tell your whole story. It is hard to do that. And if you switch from therapist to therapist, you're always having to just like tell your whole story again. And you want to be with someone that you can like progressively build on your relationship with them so that they know what you go through, they know your symptoms, they kind of get to know you and can tell if you're feeling bad and stuff like that. Good types of therapy: cognitive behavioral therapy, CBT, and also DBT, which incorporates CBT. So you can look into that. And like I said, the therapist will teach you coping mechanisms. They may have you keep a diary, which of course you don't feel like doing, but it's important to do. And you've just got to keep fighting and try to explain it to your loved ones, try to explain it to your spouse or who's with you. And, just keep trying to explain it, even if they don't understand. So that would be my recommendation to you. It can feel like you're in hell. And I guess, like, it's just really hard to put into words. It really is. It's like terrible. It's absolutely terrible. And I understand what it's like to be there. Lots of people do understand what it's like to be there. And for those of you who don't, if there is someone close to you with depression, just try to be there for them. Just play with their hair, hold their head, just sit there in silence with them if that's what they need to do right then. And if they can't explain it, just try to understand as much as you can and just be supportive. But I am going to make another video talking about things that you can do to help someone around you who is depressed, like a spouse or a friend or a family member. But I just wanted to get this out there. And if you want to share your experience, just leave it in the comments below. I will reply to all comments. I'm a little backlogged right now. And please like and subscribe this video, this channel, sorry. And I'm going to be putting out more content. Any video suggestions you have, just like leave them in the comments. I'm making a list. And I will be making all of those videos. But it's very important to know you are not alone. There are people who understand. And a lot of places have like crisis teams that can even come to your house if you're really struggling. I have not looked into that in my area, and I don't know if it's available everywhere, but some places do have that. Like, I had that in North Carolina, and they came to my house and talked with me forever. It was no cost at all, and it really helped. So I hope that I've shed some light on this, um, but it is really hard to explain, and it's hard to put into words. And hopefully one day I'll be able to find those words and explain it in a better way. But until then, just keep fighting, connect with people who understand what you're going through, and try to set up your support network so that when you need help, you can get it. And I appreciate all of you for watching. I hope you feel great, and I will talk to you soon. Thanks. Bye.